Dr. Paula and me, Michael. This is our first video. So we have decided to talk about back pain. A lot of people I know talk and say, this about back pain. I fell on the floor, my back hurts. Why is my back hurting? I ran into the wall backwards, my back hurts. Why? Please explain to me. How does that work? What hormones in your body makes your back hurt?
Okay. Back pain. Now, back pain is an interesting thing, Michael. Back pain can be as a result of different things, different sources in the back. So anatomically, if you look at the back.
What?
Oh, anatomy. So anatomy is the body. Skeleton, bone, tendons, muscles, ligaments, joints. Right. So if you look at the back in terms of anatomy, you will see some bones, like the spine, vertebrae stacked on top of each other. In between are the discs, intervertebral disc, like a slip disc. Then you'll have ligaments, then you'll have muscles.
Okay.
And so, any one of those structures, and nerves. I forgot the nerve. Any one of those structures can have a problem. So, for example, as you were saying, you're playing basketball, you back up in the basket, and you pick up your back.
That's happened to me before.
It has. You can actually hurt or bruise the muscle. That's a muscular problem. Similarly, if you were trying to lift a big box. Have you ever tried to lift a big box before?
Yes, and I lift with my back instead of my legs. My back hurts.
You lift your back instead of the legs?
I said I lift with my back. I lift with my back
very
instead
good.
of my legs.
Ergonomics. What's ergonomics? So what he just described is proper lifting techniques. We call that ergonomics. We'll do that in another video. But lifting properly is of course important. So you bend your knees and lift with your legs. You straighten your knees to lift up rather than lifting with your back. And so you hit the muscle. So the muscles get bruised. Muscle bruise. So let's talk about muscle bruising today, because it can be from the disc. We're not going to talk about the disc or the joint, which is the facet joint. You know another name for the facet joint?
No.
Zygapophyseal joint.
What?
We're not going to talk about that today.
Yeah.
And then you have the intervertebral disc and some other stuff. But let's talk about the muscles. What do you want to know about the back muscles?
What exactly, I understand if you hit up your muscle, you bruise it, ow, pain, whatever. But what exactly causes the muscle to have that chain reaction that says,
the perception
pain.
of pain?
Yeah.
Good question. Okay, so when you hit the muscle, it gets bruised. When you bruise it, you can have a little small bleeding in the muscle, like when you ever get a black and blue yet, you hit your foot and you see a little black and blue under the skin?
I have one, right? No.
Yeah. So essentially you get that in the muscle as well. So the muscles will have some little bleeding in there, little micro tears. The muscle itself might even tear, like when you tear your hamstring, so you get bleeding in the muscles. Now the thing with blood is very good when it's in the blood vessels. Once it's outside, the body doesn't like that. So the body will do a lot of chemical reactions, and they'll send in some things called prostaglandin and leukotrienes and some other chemicals. They call them pain chemicals. And then these pain chemicals will stimulate the nerves, and the nerves will take the signal to the brain and say, ouch.
Okay.
So it's a signal from the muscle through the nerves to the brain to say, I'm hurting. And then sometimes what will happen is the muscles might go into spasm, contraction. Have you ever gotten a muscle spasm?
I actually had one yesterday. Or the other day, remember my toe was
lock up, yes. Yeah. So you get muscle spasm. So
she has muscle spasms more than I can count. At least twice a week.
Yes. And we'll talk about muscle spasm, because what helps my muscle spasm are electrolytes, salts. So if I don't have a sports drink like Gatorade or Lucozade, I'll make my own with salt and sugar and lime and some water.
Question.
Yes.
For example, I hit my head in the wall the other day. I remember I was playing and the ice hit my eyebrow. Why do you stir up sugar and water and give it to me to drink? What else? How's that help?
So what he just asked is in Jamaica, or maybe the Caribbean, other islands, I'm not sure. We have a thing here where if you get a big drop or you get a big blow or you fall and you really hurt yourself, they mix a very sweet, just water and sugar solution.
Also, when I'm vomiting or like when I'm nauseous, she also gives me salt water, which helps me get the mucousy out of my system. We'll talk about that in another video. That's a different.
That's a lot of things.
Yeah, that's a lot of things.
So let us not talk about the sweet sugar water when you have a bad blow because that's a big conversation. Let's finish talking back pain. And so the pain signal goes to the brain and say ouch, and then the body now will say okay, I'm hurting. So the muscles may go into spasm, and the spasm itself can cause more pain. Can you imagine that? And the spasm might make you bend over and start limping.
The body gives itself pain to heal the pain, practically.
The body gives itself, well, I'm not so sure.
Wait. When the body's healing itself, it like does something to the parts of the body which makes you drowsy. For example, when you're sick, you have a fever, that means that your body's working and like
your immune system
going up.
Right. So you're kind of right in that. Yes, the body makes you feel pain to protect the
exactly
body.
Yes.
So for example, if your toe or your ankle is broken or sprained, the body will say it hurts, so you won't walk on it and hurt some more. Right? But then of course you have some other pain that comes from different diseases, which is pain is a big area. I am a musculoskeletal specialist. I treat pain and they call me the pain doctor, but I'm not. I'm the no pain doctor. And so pain is a complex thing. It's not very simple. But in the back, where you hit your back and you have pain, the pain is to tell you, hey, don't go back and hit up in the basketball. Don't go lifting or go back to play basketball until you've healed properly.
Okay, that answers my question. Very much so. I hope that answers yours for today's session. Thank you, Mommy, for explaining back pain.
Am I Mommy or Dr. Paula? Thank you, Michael. You're welcome.
I hope you enjoyed this video.
I hope so too. Join us next time for
something
interesting.
Yes, something very interesting, because we will review everything interesting
from the
head to the toes
and your fingernail. Bye guys.
Goodbye.